Hi, my name is Charan Gill and I'm here today in Livingston at Cosmedicare, St. Helens, and I'm here for a hair transplant, would you believe? And I know you're thinking you don't need one, but actually I do.
I hope you're well. So obviously we've had a consultation earlier when we met last time about the procedure, etc. But we'll go over it through again today, if that's okay. How you feel? Hi, my name is Dr. Bobby Calra. I am a hair transplantation surgeon. Along with this, I'm a general practitioner as well. So today we are here in Livingston under Cosmedicare, and we are going to perform a hair transplantation for Mr. Charan. I'm going to explain a little bit about the procedure of today, how it's going to go through. It's just not for just all the viewers to know that it's something that people ask a lot, and especially about pain. But we'll start from the beginning. So the way the process works in brief is that obviously the patient comes in, they have our consultation, we draw a hairline as according to what the patient wants, but also what I would suggest would be natural looking. So obviously it has to be realistic when we do it. Once that step is done, the next step would be that we would either shave the patient's hair or not, depending on the case, whether it's a female or a male, and depending on the degree of hair loss and so forth. Once that's achieved, I would normally start off with doing incision making. Now, incision making is when we make the slits into the scalp from the front all the way to the back, depending on, of course, where the grafts are required. We do normally give some anesthetic, obviously at the frontal region and obviously around the crown before we start the procedure, so that obviously it'll be a numbing sensation all the way through and the patient doesn't feel any pain. This procedure normally lasts about 45 seconds to 1 minute, and that's all it takes, because people are worried that, well, this is going to be very painful, and it's just the first 45 seconds to 1 minute, and thereafter it's a smooth ride. So that's the incision making phase, and after that we do the extraction phase. So that's where the patient will be lying down, and again we will give a local anesthetic in 5 rounds at the back of the head, and again it's about 45 seconds to 1 minute where the pain is, and after it's all fine. And then we do the harvesting, or what we call the extraction phase, where we extract the grafts from the back of the head. Once that's achieved, we normally give our patient a little bit of breather, a break, where they have a little bit of lunch or a refreshment. And then after that, we start with the implantation phase, which is where we take the extracted grafts that we had, those follicles, will then be implanted into the areas where we made all the incisions from the front all the way to the back. Of course, again, depending on what the case is from person to person. Finally, we talk about the aftercare. And that's where I talk about what to do, what not to do in the next 14 days after surgery. And then we go through a lot of things about shampoos, remedies that you can use to help with hair growth. And then we also talk about, like, people asking, the questions, example about, when they can cut their hair, if they can use a cap, whenever they can go exercise again, etc. And finally, we then normally see our patients on month 4, 8, and 12 after surgery, just to follow them up to see how they're getting on with the result. That is done by myself, because I'd like to follow my patient up to make sure they're, they're happy with the result, number one, but then also to make sure that I'm also happy with the progression.